name is Doug Masson. I'm a urologist here at Arizona State Urology, which is a subsidiary of Ironwood Oncology. And here, what we do in urology is manage prostate cancer. Prostate cancer is the second most common malignant cancer in older men, and so it's a very common condition that we get a lot of referrals for regarding an elevated blood test called PSA or an abnormality on rectal exam where the prostate has a hard lump or nodule. And what we do is when we see patients is that we examine them, go over their PSA results, see whether or not there's any additional testing that can be helpful to help us determine whether or not there's a concern about prostate cancer. In men that have a family history of prostate cancer or who are African American, we recommend that PSA screening and rectal exam start at age 40. And if there is no family history, we have men start at age 50. When we do evaluate someone with an elevated PSA and or abnormal rectal exam, we counsel them regarding a biopsy of the prostate. A biopsy of the prostate is done in the office. It can be done with a local anesthetic and can be relatively pain-free. We can use magnetic resonance imaging in addition to ultrasound to further identify where there is a tumor in the prostate gland, and so we have some very accurate methods of determining whether or not there is a tumor, but a biopsy really is the best way to show whether or not there's cancer. When you have a biopsy, it takes about 5 minutes in total to do. We take anywhere from 12 to 16 what are called cores of the prostate, unless we're using an MRI, and then sometimes we take a few more, but we can use some sedation or anesthesia to do that. When we look at the tissue under the microscope, we determine whether or not there is cancer in the prostate gland. There are additional genetic marker tests that can be done on the prostate cancer tissue in order to determine whether or not we think the cancer is aggressive and will be something then that will cause growth and potentially spread outside the prostate over the lifetime of a man that we are treating. One thing today about prostate cancer is that some cancers are very slow growing, and in some men they won't really cause any problems. And so we fit men into what's called active surveillance, which means that the cancer we observe, and there's a reasonable chance that in active surveillance a man will go on and lead a full life and really not need any treatment for his prostate cancer. If it's felt that your prostate cancer needs treatment and you would not go into active surveillance, we can either do radiation treatment or surgery to take out your prostate if we feel the cancer is confined to your prostate gland. Doing surgery includes often doing robotic surgery that is minimally invasive and leads to a quicker recovery. If the cancer is beyond your prostate and we feel you need additional therapy, we send you to one of our radiation oncologists or medical oncologists to consider either chemotherapy or certain types of immune therapy or hormonal therapy. One of the advantages to Ironwood Oncology is the collaborative effort that we have with other specialties, radiation, medical oncology, in order to give you complete care for your prostate cancer. After the surgery, we see you and follow you up for any problems that may arise related to treatment. We do manage urinary problems. We do manage erection issues that may be present before or after the operation. And we continue to act in a collaborative way with our colleagues in medical oncology and radiation oncology. If you have an elevated PSA or have prostate cancer, we're more than happy to see you here at Arizona State Urology or at any urology office within the Ironwood Oncology Network.